So we have a patient who takes in what? Decoxin. We spoke about it yesterday. We said decoxin is for what? Is for treatment for chronic cardiac insufficiency. This one, you remember it. Chronic cardiac insufficiency. For acute, we give what? Corglycon. 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 That would be for acute cardiac insufficiency. Now the question is, what diuretic may increase the decoxin toxicity due to the intensified excretion of potassium? So we are looking for a diuretic that leads to increased excretion of what? Potassium. That is what the question is talking about. So what do? You are definitely going for a thiazide diuretic, a thiazide diuretic, a thiazide diuretic. And the thiazide diuretic in this option is what? Is hydrochlorothiazide. Hydrochlorothiazide. Please, no videos. Thank you. It's hydrochlorothiazide. Hydrochlorothiazide. Of course, spironolactone will lead to what? It will spare the potassium. That means potassium will be increased in the body rather than decrease. Okay, so here we are going for what? Hydrochlorothiazide. Hydrochlorothiazide. All right. We have a patient with coronary artery disease admitted to the cardiological department. Stenocardia prevention. Again, we're talking about stenocardia, right? We say stenocardia. Normally, what drug do we use? We use nitrates. We use organic nitrate. Example is what? Nitroglycerin. Nitroglycerin. We've made mention of this several since yesterday. So, what stenocardia prevention? For stenocardia prevention, a drug, but now they're changing the drug. They said a drug from a group of beta blockers, beta adrenal blockers. So, what are you thinking about? A beta blocker that can help the heart to relax and not be in pain is what? Beta blocker. Example is what? Metoprolol, 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 or propranolol, propranolol, or anapelin, anapelin. Yesterday we made mention about all these beta blockers, propranolol or metoprolol. Anytime you see law, you're thinking of what? A beta blocker, beta blocker. So here you are thinking of what? Of A. But of course, if they are not asked you to be specific about a group of drugs, we would have gone for what? Organic nitrate like nitroglycerin or isosorbide nitrate. All right, so here we'll go in for what? For A. We have a patient suffering from pulmonary tuberculosis. Yesterday we talked about tuberculosis. We talked about tuberculosis, and we said the first drug that we give for tuberculosis patient is what? Of course, isoniazid, isoniazid, isoniazid. The second group is called what? Rifampicin, rifampicin, rifampicin. Then we have ethambutol, ethambutol. All right. So over here, we are thinking of what? We are thinking of isoniazid because they are saying that the treatment results in what? Neuritis, neuritis of the visual nerve, neuritis of the visual nerve. And the side effect of isoniazid is actually what? Uh, it's actually this drug. The side effect is actually this drug. The side effect is actually that's why normally when we are given isoniazid, we add this vitamin B6 to it, vitamin B6 or pyridoxine, 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 pyridoxine to prevent peripheral neuropathy or neuritis. Neuritis. So we are thinking of it as what? As isoniazid. Isoniazid. So here your answer will be B. All right. So we have A patient is ill with amoebiasis, was prescribed a certain drug. Guys, you remember this one. This is what amoebiasis, amoeba. So it's what protozoa. And we said, what drug do we give for protozoa infection? Of course, metronidazole. Of course, metronidazole. Now, they're saying the use of alcohol together with this drug is contraindicated because the drug inhibits metabolism of ethyl alcohol. So, what drug is this? We already know this one. Amoebiasis, to treat amoebiasis, give us metronidazole. So, here we go in for what? For E as our likely answer, metronidazole. Metronidazole. All right. We have a patient suffers from, guys, look at it, chronic left ventricular insufficiency. Chronic is the same as chronic heart insufficiency or chronic cardiac insufficiency. It's the same thing. So, what medication do you give? We've made mention about it several times. So, here you're going for what? Decoxin, 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 decoxin. You see why I said if you understand this thing, you don't have any problem. If you understand it, you don't have any problem. So, it's what? Decoxin. So, if you have not watched the video, please try and watch them. All right. So we're going for what? Decoxing because we are talking about what? Chronic heart failure or chronic cardiac insufficiency. Again, if it is acute, what would you do? You give glycon. Please be writing them down because they are going to really be useful to you. All right.
Doctor, could you please repeat your last sentence?
I said glycon because glycon is for acute cardiac insufficiency. Acute cardiac insufficiency. For chronic, we go in for decoxin. Decoxin. For chronic, for acute, glycon. Cor is CORGLYCON. Glycon. Glycon. So that is for acute. But here, we're talking about chronic. So we go in for decoxin. All right. We are saying that a patient is ill with chronic cardiac insufficiency. Again, they've given you chronic cardiac insufficiency. So what drug do you think will be given? Of course, decoxin. Of course, decoxin. Medicine is so sweet. Of course, decoxin. So 2 weeks after taking it, there were symptoms of drug intoxication. Yesterday we talked about it, and someone even asked a question about the differences between material and what functional cumulation. Material and functional cumulation. And we said for material cumulation, it has to do with the attachment of the medication to proteins. The attachment of medication to proteins. And decoxin has high affinity for proteins. And we know that proteins are not easily excreted from the kidney. Proteins are not easily excreted from the kidneys. So that's why over here we easily go in for what? Material cumulation. Material cumulation. Now, in functional cumulation, although there is excretion, still the effect is still high in the body. The effect of the drug is still high in the body, although it is not present in the system because it has not excreted. So that's the difference between functional and material. So here you are thinking of what? Material. You are thinking of material. You are thinking of material. All right.
Doctor, please, sorry, could you please explain why it's like in terms of functional?
Okay. So I will explain it for you. But so what we'll do is that if you have any question, you try and then write the question down so that when I'm done with the presentation, you can bring the question up. Otherwise, if we break in between, we might not be able to finish. If you break in between, we might not be able to finish. I've seen that people writing messages for me, but I'll go to them later on. Okay. So for the sake of you are new and you didn't know, so I'll go back and then explain the difference between material cumulation and then functional cumulation. Like I said, with material cumulation, it is when the drug has affinity, has affinity for proteins, for proteins, for proteins. So the drug is attached to the proteins. Okay. Now, so as a result, if you give too much of the drug, what it means is that it will attach to more proteins. And because these proteins are not excreted, that means you have what? Drug overdose in the body. Drug overdose in the body. As a result, you have an adverse effect of the drug. You have an adverse effect of the drug. And the is one of those drugs that has affinity for proteins because they are made of leaves. They are made of leaves. So they have that kind of affinity for proteins. Now, in functional cumulation, that's what the name is what functional. So it has to do with the mechanism of action, or it has to do with the effect of the drug. So although the drug might not be present in the system, it is still functioning. It is still functioning. And this kind of drug, they are not accumulated because they are excreted. They are easily excreted from the body. They are easily excreted from the body. That means they have no affinity for proteins. So they easily get what? Excreted. So that's what distinguishes material from function. So even though the substances are not in the body, still its effect is very, very, very high in the body. Its effect is very, very, very high in the body. So once again, you guys should write all your questions down as I'm going through the questions. So if it's material, just write it down, material combination, so that when we are done with the presentation, we can come back and then clarify so that we can finish in time. Because we have a lot to do. We have a lot to do. So we have to finish it. All right. Mhm. We have a target. Let's meet the target. Then we can ask our questions. So write the questions down and then we will come to them one after the other. Okay. So a patient with drug intoxication presented with dryness of the oral mucosa. Dryness of the oral mucosa. Do you remember reduced saliva? Reduced saliva, and we said that one is caused by what? Atropine sulfate. Atropine sulfate. So atropine sulfate leads to what? Dryness of the oral mucosa because there's no what? Saliva or there's reduced saliva. So this drug could be as an intensification of what? Of atropine sulfate. Atropine sulfate. We did it or we discussed this question yesterday. So try and watch the video, guys. Let's try and watch the video. So a patient with drug intoxication presented with dryness. And then there's what? Mediatic people. That means their eyes are widely what? Open. Widely open. uh, Such action of this drug is associated with what? So of course, since I'm talking about atropine sulfate, or they are indirectly referring to what? Atropine sulfate, we also know that atropine sulfate is what? Anti-muscarinic what? Receptor, or anti-muscarinic what? Drug. Anti-muscarinic drug. So over here, we are talking of what? Muscarinic uh, cholinesterase block is the same as anti-muscarinic. Anti-muscarinic is the same as anti-muscarinic. So the same thing. So here we're talking about A as our likely answer. A. And what is the opposite for the atropine sulfate? Of course, proserine. Proserine. We discussed it. Proserine. Proserin. Proserine. Proserine. We talked about this yesterday. So guys, all right. So we have a patient with a limb fracture must be administered a depolarizing drug from myorelaxant group. Do you remember? We talk about this. Or muscle relaxant. Muscle relaxant. Muscle relaxant. So what drug do you give? What drug do you give for muscle relaxation? Of course, ditilinum. Of course, ditilinum. And one thing is that botulinum works with what? Pseudocholinesterase. Pseudocholine. These are things we have already discussed. So I'm just reminding us, or we're just reviewing them so that we don't forget them. They deal with what? Pseudocholinesterase. Now, if this pseudocholinesterase is deficient, what it means is that even though we said for a short term, the relaxation could last for a long time. It could last for a long time. It could last for a long time. So you must always make sure that your pseudocholinesterase is what is working properly. So here we are taking of what ditilinum. That is a drug of choice for muscle relaxation. All right, because we're going to do surgery. All right. A patient is suffering from chronic bronchitis, takes a synthetic mucolytic drug, that facilitates sputum thinning. Sputum thinning. So this one, you're looking for what? A drug that can break down what the mucus. You're looking for a drug that can break down what the mucus so that the viscosity will be reduced and then the phlegms or the mucus will easily what come out. And that drug is what? Is acetylcysteine. It's actually a cough mixture. It's actually what a cough mixture. It's actually a cough mixture. So it's what acetylcysteine. So here we are going for what acetylcysteine. In the practical, we will say a carbon cysteine or acetylcysteine. So it's the same thing. All right. I guess you can remember this question too. We have what? Burned skin surface. Burned skin surface. Burned skin surface. That means you need to do what? To dress the wound. You need to dress the wound. You need to dress the wound. And what antiseptic will you use? Of course, potassium permanganate. Potassium permanganate. So that is the antiseptic that you can use for dressing wound. We made mention about it yesterday. We talked about this yesterday in detail. So potassium what? Permanganate. Potassium permanganate. For what? For dressing the wound. For dressing wound. For dressing wound. For dressing wound. For dressing wound. Now, if somebody comes with also burn, what you can also do is that we add what we call a silver substance to it, because silver helps in healing of the burnt skin. It helps in healing of the burnt skin. But the potassium helps in what? In preventing infection. That's what we call it antiseptic. That's what we call it antiseptic. Antiseptic. All right. So the answer is what? Is D. We have good. On the second to third day after stomach recession, intestinal paralysis wasn't restored. Intestinal paralysis wasn't, sorry, peristalsis wasn't restored. What is to be administered for stimulation? For stimulation of this. Now, we have difference between what? So you're thinking of atropine or thinking of proserine. And we said atropine cannot lead to what? Peristalsis. Why? Because it will lead to what? Dryness of the mucus. Everything will be what? Will be slow and stuff like that. So you're thinking of what? A proserine. You are thinking of a proserine. Because proserine is the direct opposite of what? Of atropine what? Sulfate. Atropine sulfate. So proserine helps in the stimulation of intestinal peristalsis and the tonus of the urinary bladder. It helps in this thing. So you are thinking of this as well as a proserine. Proserine. So please check note this atropine proserine. Don't get confused in an exam room. Please don't get confused when you see them in exams. All right. So we have good. Look at it again. A dermatologist injected a patient with certain drug in order to reduce salivation. Guys, do you remember? To reduce what? Salivation, and we're just talking about it. So you're thinking of it as what? As atropine, not proserine. You are thinking of this as atropine, atropine to reduce salivation, dryness of the mucus. So you are thinking of atropine. This is interesting. Very. Guys, look at this again. A patient with chronic cardiac insufficiency. Again, chronic cardiac. So what do you give? Of course, you give what? Digoxin. Actually, it's a plant, right? So it is called digitalis. It's a plant. So the plant name is digitalis, but it means digoxin. It's the same drug, digoxin. Preparation for a long time. Due to violation of the intake schedule, the woman got symptoms of intoxication. Again, there is what? Intoxication. So what is the mechanism of action? Of course, material accumulation. Material accumulation. We've spoken about this already. Material accumulation. Material accumulation. You see how the question are being repeated, but in a different way. Repeated, but in a different way. So you understand it. You have a problem. So we have to understand every single question, know the mechanism or how they are being done or how they perform their actions. You must know them. Okay, so now before tooth extraction, a patient will advise to take a certain drug for hemorrhage prevention. Of course, you're going to remove your tooth. There could be what? Hemorrhage. So what drug will you give? So this one, you are looking for what? A vitamin K supplement. Vitamin K supplement. Vitamin K supplement. And vitamin K supplement here is what? Decasolon. 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 Vitamin K helps in what? Coagulation. It prevents bleeding. It prevents bleeding. It helps in coagulation. So you are thinking of what? A coagulant. A coagulant. And that coagulant is what? Is decasolon. 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 All right. Don't forget that heparin is anticoagulant. Guys, some of them get confused. The heparin is anticoagulant. Anticoagulant. But we're looking for what? A coagulant. Okay. Good. They say a man who has been taking a drug for a long time cannot withhold it because this causes impairment of psychic, somatic, and vegetative function. Name the syndrome of different disturbance caused by drug discontinuation. Guys, the people give you the answer. This was drug discontinuation. You remember when we talk about what? Withdrawal syndrome or withdrawal symptoms. Withdrawal symptoms. The same as what? Discontinuation. They say as abstinence. It is the same as abstinence. 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 This is when cessation of a drug causes what? Adverse effect on the body. Cessation of a drug causes adverse effect on the body. So basically, that's what they are talking over here. So here we're talking about what? Abstinence. 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 Because you are stopping the usage of that drug. So you're going to have what? The effect. The effect. Like somebody who likes taking alcohol, you will see how they react. Okay, so you are taking off what? A as your answer. All right. Good. A patient was consulted a hematologist about purulent inflammation of his gums. What drug would be most effective if he suspected what? If it is suspected that the causative agent is anaerobic. 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 So here, most anaerobic drug or the drug that can treat anaerobic condition mostly is metronidazole. Is metronidazole. Don't forget, metronidazole is also what? Antiprotozoal drug. We made mention that it's what? It prevents giardia. It is used in the treatment of what? Entamoeba. It is used in the treatment of trichomonas. It is used in the treatment of vaginalis. It is used in the treatment of what? Anaerobics. Anaerobics. And it's also used as a combined therapy in the treatment for what? H. pylori. H. pylori. I repeat, it is an antiprotozoal and it is used to treat Giardia, used to treat entamoeba, used to treat trichomonas, used to treat vaginalis, and it is also used to treat what? Anaerobics, and also in a combined therapy against what? H. pylori. H. That's ulcer. H. pylori. H. pylori. So basically, we're thinking of it as metronidazole. Metronidazole. All right. 45-year-old patient suffers from neurosis, characterized by irritability, sleeplessness, motiveless anxiety. What drug will eliminate all of these things? All of these things. So give a drug that will make the person sleep, and everything will come back to normal. Give a drug that will make the person sleep. So what drug are you talking about? Of course, diazepam. Of course, diazepam. Diazepam. Okay. So when he sleeps, it becomes better. When he sleeps, it becomes better. All right. Before you continue, of course, a drug that can cure the neurosis. So first of all, stabilize the patient by giving a diazepam. A 12-year-old child has intolerance to some food stuff. What it means is that it doesn't like some food substance, some food substance. So when you eat it, you begin to get what? Reactions to it. And he said their consumption causes allergic reaction in the form of itching skin eruption. Guys, what antihistaminic drug are you thinking about? Of course, loratadine. We've spoken about this several times. Antihistamine drug is what? Loratadine. Every time they give you loratadine, please choose it. Choose it. Choose it. So you're thinking of what? Loratadine. Loratadine. Okay. So they say a patient has entered the admission office and had the following signs of acute. Guys, look at this. I love this question. Acute cardiac insufficiency. Acute cardiac insufficiency. Do you remember what we talked about? Acute cardiac insufficiency and chronic cardiac insufficiency? Of course. We said for acute, what do we give? So we said for chronic, what do we give? We give a decoxin. A decoxin, of course. Decoxin and then dicotoxin, they are all the same thing. And for acute, we give what? Corglycon. I keep mentioning this word or this drug. Corglycon. Corglycon. Acute because of acute. But if it is for stenocardia, we give what? Nitroglycerin or organic nitrate. Nitroglycerin. Nitroglycerin. I believe you remember it. So here, definitely, we are going for what? For D as our likely drug. All right. So a patient with myocardial infarction. Like I said, myocardial infarction has to do with insufficient of blood to the tissue or oxygen to the tissue, and was admitted. They said the patient, for pain relief, he decided to take he decided to potentiate fentanyl action with a neuroleptic drug. So what drug are they referring to? So here they are looking for what? A neuroleptic drug that can be combined with fentanyl. That can be combined with fentanyl. And that drug of choice is what? It's droperidol. That's the drug combination. That is the drug combination. Of course, aminazine is also what? It's also a neuroleptic drug, but it doesn't have, or you can combine it with fentanyl. Pentane. So here you're thinking of what? Droperidol. So here your answer is what? Is D. Please take note of this question just in case you need it in your exams. Droperidol. Droperidol. It is a drug interaction. That I don't know how to explain it again, but that is a drug interaction. All right. We have a patient with bacterial pneumonia. Was prescribed with what? Benzene penicillin. We may mention that benzene or penicillins are actually what? Beta lactam. Beta lactam antibiotics. Beta lactam antibiotics. And what it does is that it destroys what? The peptidoglycan wall or cell wall. Peptidoglycan. 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 I believe you remember it. So over here, we are going for what? So they say what is the what? Mechanism of action. Mechanism of action is inhibition of what? Microsomal cell wall. Inhibition of the cell wall. So that's what peptidoglycan. In some question they wrote the peptidoglycan. But over here, they didn't write the peptidoglycan. But it is the same thing. It is the same. So here, you are thinking of E as your answer. So a patient has a hepatic rash. Hepatic rash. What medication are you giving? So first of all, that is what? Herpes. Herpes. And herpes are what? Are viruses. Herpes are viruses. So what do you give for viral medication? So what viral medication can you give? Of course, acetylpropyl. Acetylpropyl is antiviral drug, and that is what we are looking for. Antiviral drug. The rest are what? Are antibiotics. But we're looking for what? Antiviral drugs. Antiviral drugs. So here your answer is E. E. So a patient who has been treated in a neural clinic has been taking a sedative for a long time. When they say somebody is taking something for a long time, that means start thinking of what? 8 effects. Start thinking of what? 8 effects. 8 effects. And the effect that they're having what? Cough, rhinitis, and what? Epiphora. That is what? A lot of what? Tears or lacrimation. Lacrimation. What drug causes these disturbances? Of course, almost everything here are all what? They are all how do you call it? They all induces what? Sleep and stuff like that, or they are all sedative drug. But the one that has side effects as these is what we call what? The sodium bromide. Sodium bromide. Sodium bromide. That's what in clinical settings or in practice we normally prefer to use the diuretic because it has less adverse effects. It has less adverse effects. But sodium bromide has a lot of adverse effects, like this present or these complications which are being shown over here. So here we are talking of sodium bromide, sodium bromide, sodium bromide. All right. So we have, in order to accelerate healing of an ulcer, a vitamin was administered. A vitamin was administered. So what vitamin are you thinking about? So in order to accelerate healing of a radiation ulcer, a vitamin was administered. What vitamin are you thinking about? You are thinking of it as what? As a vitamin A. You are thinking of what? Vitamin what? A. Because it's a very, very important vitamin for healing or for wound healing. Wound healing. Wound healing. Vitamin A for wound healing. And even ascorbic acid. So over here, we will go into vitamin A. And the vitamin A that is present here is what? Retinol acetate. Retinol acetate. Retinol. Now, of course, if deficiency will lead to what? Night blindness. So also note that. So with the eye too, we are thinking of retinol acetate. But apart from the eye, the other thing is that it helps in wound healing. It helps in wound healing. It helps in wound healing. So here we go in for retinol acetate. Okay. A patient with hip fracture, again, was prescribed a narcotic analgesic. Narcotic, when we say narcotic, we're talking about hard drugs. We're talking about opioids, like morphine. Am I right? Of course. Now, its anesthetic action is determined by what? Of course, opioids. We're talking about opioid receptors. You are thinking of opioid receptors. So you're thinking of A as your answer. Opioid, narcotics are hard drugs, and hard drugs interact via opioid receptors. Okay. A patient with hypertensive crisis was admitted in the cardiological department and was injected with what? Antihypertensive drug. But look at the drug. It is what? An alkaline earth metal. An alkaline earth metal. So you are thinking of magnesium. Alkaline earth metal. You are thinking of magnesium. You are thinking of magnesium. You are thinking of magnesium. So here we go in for what? Magnesium sulfate. Magnesium sulfate. Magnesium sulfate. Because magnesium that has that kind of, if you check the periodic table, the group of magnesium is what? Alkaline earth metal. If you check on the periodic table, you should see this magnesium present. You see this magnesium present. All right. Good. So a patient with acute morphine poisoning. Again, morphine is what? A narcotic drug. How does it interact? Of course, opioid receptors, opioid receptors, opioid receptors. And if you can remember, we said opioid intoxications or morphine intoxication. What do you give? You give what? Naloxone. Naloxone. Now with glutathione, you are thinking of what? Of metals or heavy metals like mercury, like lead, like arsenic. And we even said even in what? In bismuth preparations we go in for what? Glutathione. As for opioid or for narcotics or for morphine, we are going in for what? Naloxone. Naloxone as its what? Antidote or antagonist. Antagonist. So here, your answer is what? Is A. Your answer is E. Your answer is E.